Baruch here with genConnect and Dr. Erroll Gordon from Mount Sinai. Dr. Gordon, why is it so important to really use a simulator like this before cutting open a patient and going into their brain?
So surgery is a very complex procedure, and no one wants to undergo surgery without knowing that the surgeon has the most information that they need in order to to do the operation safely. And sometimes surgery can be very tricky. There's surprises, and you want to be able to minimize the surprises that may happen.
What's the most incredible part of using this sort of simulator? What's most incredible about this actual technology?
I think what's the most incredible is that you can simulate the actual brain surgery itself based on the patient's own anatomy. It takes the information from a high-resolution CT scan or MRI of the patient, and it allows the surgeon to manipulate in a three-dimensional manner all the different structures and make them aware of all the potential obstacles, maybe blood vessels that they may have to deal with prior to cutting open the patient.
So fewer surprises.
Fewer surprises.
Give us a little look into the process of using this actual simulator.
So this is the surgical theater, or a device from the surgical theater, and essentially what you would have is a patient would get an MRI or CAT scan, and the MRI CAT scan typically gives you information like this, right? This software then takes this information and converts it into this 3D representation of the patient. With this 3D representation, you can manipulate the images such that it could represent what the surgeon would see in an actual OR. And the surgeon can then choose the approach that they may take. And then what this also allows you to do, in this particular case, this is a person with an aneurysm. And the surgery that would be needed is to clip this aneurysm so that the aneurysm would not rupture. If the aneurysm ruptures, it could be fatal. This machine has all the available clips that are represented digitally. And so the surgeon could actually use this machine to evaluate the best approach.
So you're actually testing different tools that you would use in a real surgery.
Exactly. The different tools to see which one would be the appropriate one, what are the obstacles that may be faced with the approach that you're doing, which clip would navigate the different structures of the vasculature. This represents aneurysm clipping, but this could also be used for tumor resection of the brain, and a whole host of different neurosurgical procedures can be simulated and practiced before the patient actually goes to the OR.
All right, now take me over to this device over here. I understand you would actually use this during the surgery.
So this is the SNAP device, also a product of surgical theater. And basically the 3D information that was gleaned from the patient's imaging studies can be imported here. And this would be something that would be actually in the OR, and it would be hooked up to the navigational devices that are already available in the OR. And it helps orient the surgeon in a three-dimensional way where their tools may be. So if you pretend that this is a tool or device or navigation tool that
the patient is right here, right? This is
the patient's right here, and you wanted to know the structure that you're pointing at, how it relates to other structures in the brain. You basically you could see how this is then represented in a three-dimensional form. The tip of the tool, where it represented, and you could see the objects that would be close to the area of the object that you're pointing to.
Incredible. Dr. Gordon, thank you so much, and thank you for saving so many lives with your work.
Thank you.
And for more Dr. Gordon at Mount Sinai, be sure to check out genConnect.